This is the right kidney. This is the upper pole. This is the lower pole. This is the lateral border. This is the medial border. This is the anterior surface. This is the posterior surface. And this is the hilum, where we see the renal vein, renal artery, and the renal pelvis or ureter. Ureter is the most posterior structure in the hilum. This is the left kidney. This is the upper pole. This is the lower pole. This is the lateral border. This is the medial border. This is the hilum. This is the left renal vein. This is the left renal artery. And this is the ureter. Note that it is the most posterior structure here in the hilum. Here is the posterior surface of the left kidney. Okay, let us hold the kidney in anatomical position. Right kidney, I will hold in my right hand. Anterior surface here. You can identify anterior surface looking at its convexity. It is convex. Posterior surface is a bit flat. Then the renal pelvis or the ureter, that is very close to the posterior surface, and the ureter should hang down freely without a bend. If I hold it in a wrong way, the ureter will show a kink or bend. So we have to avoid this. We have to hold it in such a way that the ureter hangs down freely. So keeping these points in mind, I'll hold the kidney like that. Upper pole is tilted inside a bit, lower pole downward and laterally, and the ureter has the most posterior structure towards me and hangs down freely without any kink. So that's how to identify the right kidney. Then the left kidney, so I have to hold it this way. Look at the renal pelvis hanging freely, and it is closer to posterior surface. First, anterior surface. The right suprarenal gland is related to this area. The right lobe of the liver is related to this area. Second part of duodenum is related to this area. Right colic flexure is related to this area. And the coils of small intestine, jejunum and ileum, are related to this area. The relations of the left kidney, anterior surface. We have the left suprarenal gland related to this area. The spleen related to this area. And between the two, this area is for the stomach. Then this area is related to the pancreas from here to here. This area is related to left colic flexure, and this area is related to the jejunum.